Well, if you've been diagnosed with an autoimmune disease, chances are you've been scouring the internet and you're trying to find ways to help yourself naturally and really just have a better understanding of what might be triggering your autoimmune disease. You may have heard about lectins and maybe possibly even the role that they play in various autoimmune disorders. Now, for many people, reducing or even eliminating lectins can drastically improve their health. But what exactly are lectins? How do they affect our immune system? How do they influence autoimmune diseases? What's the connection that they have with leaky gut? What foods should you avoid if you do decide to go on a lectin-free diet? Well, stay tuned, because in today's video, I'm going to help you have a much better understanding when it comes to lectins and autoimmune disease. Well, if you're new to my channel, I'm Dr. Hagmeyer, and in this video, I want to help shed some light on something that really could make a big difference for your health and your quality of life. So what are lectins? Well, technically, lectins are carbohydrate binding proteins that are found in animals and in plants. Simply put, they are specialized proteins that allow cells to really connect to one another or stick to other cells. And that is going to be really important, and you'll see why that's just so important in just a moment. Approximately 30% of the food that we eat actually contains lectins. In fact, some of the foods that you've probably already eaten today have had high amounts of these lectins, and it may be one piece of your health puzzle that's been overlooked. Lectins include whole grains, seeds, nuts, legumes, and nightshades. Now, nightshades include things like tomatoes, potatoes, peppers, eggplants, even chili peppers. The lectins that you're probably most familiar with, though, is found in wheat, and it's something known as wheat germ agglutinin. So why are lectins so problematic? Well, there are several reasons as they relate to autoimmunity. Number one is that they're very sticky, like I mentioned ago. Your gut lining, or your gut barrier for that matter, is a single layer of cells that normally stay connected by tight junctions. These tight junctions are how the nutrients are passed and basically get into our bloodstream. The epithelial cells in the gut are like finger-like projections. These are called microvilli. And when food is digested, these microvilli absorb nutrients and they transport them through the bloodstream, through those epithelial cells rather, and into the bloodstream. Now, normally these tight junctions stay closed, right? Only nutrients are allowed to pass through them and again finally get into the bloodstream. When the gut barrier becomes leaky, or when those tight junctions become permeable and they open up, they allow unscreened molecules through that border into the bloodstream. Now, examples of things that can get through this barrier are going to be things like bacteria, pathogens, yeast, incomplete digested proteins, and again, that's what we call a leaky gut. Now, as this process continues over time, the intestinal lining becomes damaged and it even becomes even more leaky. So essentially more undesirables begin to pass through this intestinal wall and gain entry into our bloodstream. So imagine if you don't know you have a problem with these lectins and you continue to eat these lectins day in and day out, and they continue to stick to the gut barrier, never allowing your gut barrier to really heal. That's problem number one. Problem number two is that lectins are not broken down by stomach acid, and this makes them virtually resistant to digestion. Over time, as the gut barrier becomes more and more leaky or leakier, these lectins enter our circulation, stick to tissues where they now initiate an inflammatory reaction within our gut or even within our body. Once they enter the bloodstream, they can bind to any tissue of the body: the thyroid, the pancreas, collagen in our joints, nerve tissue, and then of course they can cause an autoimmune inflammatory attack on any of those tissues that I just mentioned. Now, this binding disrupts the function of that tissue and causes white blood cells and the immune system to begin attacking this lectin-bound tissue, in the process of destroying it. This is an autoimmune response. Now, the lectins found in wheat, for example, are specifically known to be involved in celiac disease. And the lectins found in wheat and potato and tomato and peanuts, these have been shown to increase something known as class II HLA antigens on cells that normally don't display them. This is of interest to researchers who found thyroid disease and diabetes to be associated with these kinds of lectins. So we do know that lectins really play a role in a variety of different autoimmune diseases. through a variety of different mechanisms. The third problem with lectins is that they interfere with the absorption of nutrients. The nutrients that they most affect are calcium, iron, zinc, phosphorus, which is really why lectins are considered anti-nutrients. Now, I want you to take a look at most nutritional supplements, especially related to the gut. What do they contain? They most always contain zinc. Why? Because zinc helps repair the gut barrier. So if you continue eating these foods, creating a zinc imbalance that can slow down any efforts in healing the gut barrier. Now, the fourth problem with lectins is that lectins can also alter our gut bacteria or cause intestinal dysbiosis. Lectins can basically strip away the mucus layer of the gut, exposing the mucus to bacteria, yeast, parasites. And this disruption in the mucus layer, this dysbiosis, once again contributes to gut inflammation and intestinal dysfunction. So the last thing I want you to know, and I think this is really important for people who have a history of ulcers, gastritis, H. pylori, or inflammatory bowel disease, is that some lectins, like those that are found in kidney beans, also cause an increased release of histamine from gastric mast cells. In the gut, mast cells stimulate acid secretion, and so in a situation where someone is already dealing with an active ulcer, additional acid would be like rubbing sandpaper on a wound. So how do you know if you need to eliminate lectins and eliminate nightshades and follow a, let's say, lectin-free diet? Well, it really comes down to testing and identifying these offending foods, which include lectins and nightshades, and then working with a qualified and experienced doctor who specializes in this area. I think is super critical. These tests detect antibodies against immunoglobulin G, IgG, or immunoglobulin A, IgA. And it's these antibodies against the tight junctions like leaky gut may serve as a guide for the elimination of these lectins from the diet because they confirm that you do indeed have a leaky gut. Now, if you have an autoimmune condition, I believe you owe it to yourself to explore this leaky gut, lectin, and autoimmunity connection in the overall healing journey to your healthy future. Hope you liked today's video. If you did, please make sure that you subscribe to my channel. If you like this material, here's another video that I recommend that you watch. Until next time, take care.